And like I say, 12 weeks ago, we had this surgery. At that time, I weighed 320 pounds. That's what the picture is. And I'm 84 pounds down today. It came down so fast, it's kind of scared me a little bit. And I'm hoping I'll level out pretty soon. I'm only dropping probably a couple pounds a week now, but
the initial weight loss is often the biggest. And if you have some other illnesses, diabetes and things like that, sometimes there's a lot of fluid in the body. It's kind of like wringing out a sponge.
Yeah. Well, I was borderline diabetic. I had to take 3 different blood pressure pills per day just to try to keep it anywhere close to normal. I've been on Lipitor forever. Sleep apnea. I was already scheduled to have carpal tunnel surgeries and my gallbladder out, and I called Dr. Rutledge a couple weeks before we would come out, well, when they were talking about scheduling that stuff, and he said, just hold off because you may not have to have that. And sure enough, they've canceled the surgeries because the carpal tunnel's gone, the gallbladder straightened out, and he pointed out that taking the Actigol probably would do that, and I'm sure that's what it did. And so really, it's just been an amazing experience for me because I got an opportunity to step out of a big old fat body with all these health problems, and in that short a length of time, just step into a different one with no health problems. And it's just been absolutely amazing. And my doctor, I had blood tests last week, and he's just ecstatic.
Oh.
My blood tests were all normal, every one of them, with no medication. He just can't believe it. So, I have no complaints at all. It was the best thing I ever did. And
now we have a couple of stories. Let's see. Your wife and you came out.
Yeah.
And you have.
She's supposed to be here, but she's out on the phone right now.
Oh, that's okay. But she and your sons were a little skeptical.
Right.
Your son is a physical therapist.
Both of them.
Both of them. And so we were having a clinic, and so they asked, what about? I mean, kind of a physical therapist question. What about diet and exercise? And.
Yeah, that's all I ever heard from my sons. They both are physical therapists. One of them has his own personal training business, and the other one is in the medical field. And of course, they just have hounded me for years. Exercise. And 3 years ago, my doctor was jumping on me hard, saying, "You've got to do something. Your days are numbered." And I said, "Okay, gastric bypass." He said, "Oh, no, you're not going to do that. There's too many complications." I went on the internet, and I found Dr. Rutledge's site. And I actually called him that day. And he actually answered the phone, which is, I just can't believe a doctor.
Amazing.
And visited with him and liked what I heard. So I went back to my doctor then, and I says, you need to go on this website because they'll show you an operation, they'll give you all the medical terms. I want you to check this out. So he did. And in just a couple of days, he says, this is what you need. It took 3 more years to convince my wife and kids.
Yeah, they were skeptical.
Literally had to fly her out here. My 2 kids live in Las Vegas. And we all came to this meeting. And when we left, they said, okay, we agree. Even my physical therapist sons, who they actually are having patients or people like me come to these meetings now. As a matter of fact, I have to meet with one after 1 o'clock today. She came to one of them, and now she wants to meet again with me before she signs up. But they actually have clients that they say, well, we're not doing them any good, they need to come see Dr. Rutledge. So.
And it's not either or, of course. The beauty of the situation is we often see people who can be successful with diet and exercise, and they are blessed with lower levels of ghrelin and higher levels of peptide YY, and so those things can make a difference. But there are times when we can work together. In other words, that diet and exercise on top of us impacting the gut physiology and anatomy can give a real healthy life. And so, but I think that we definitely know there's lots of people that you can yell at and fuss at for a long time, and they're just not going to eat less and exercise more and get thin. Hey, we were just talking about you.
Yeah. Here's my wife.
What do you think?
Awesome.
Huh?
Pretty good.
What?
Very good.
Huh?
Yeah.
And eating really is not much of a problem. I eat 5 or 6 times a day, but like one of my meals might be half a banana or some almonds or something. And like the other night we ate at one of the hotels, and that was the first time I ate any steak to amount to anything. And didn't even eat much of that. But now that one let me know that I was.
You're a little early.
Definitely
Steak is
full.
more like a 6-month thing, but some people can go earlier. But you're going to be able, as you notice that right after surgery, you're just having to have soups and small things.
Yeah.
Now at 3 months, more is coming. And as you look down the road, 6 months and a year, you should be able to basically eat anything you want.
Yeah, well, I ate it, it was fine, but it just let me know that I was extremely full, and I'd better not put nothing else down there.
Right.
But chicken and fish has been no problem at all, and so.
Good. Well, let's ask questions. Any questions from your wife? Medicines, how he's doing?
I don't know if I want to ask you about
Why? You did great. I think we did good last time. You had a lot of good, tough questions for me.
Actually, I don't have any this time.
Yeah.
I think I'm...
He's doing pretty well, huh? Yeah,
He's
yeah.
pretty
And
well.
taking your vitamins, you okay with
Oh,
that?
yeah.
And
Yeah.
you understand about the supplements and...
Yeah, I don't know if I'm gonna have to have any kind of plastic surgery stuff, because I've got some loose skin. I'm hoping that'll tighten up. But
Yeah, and here's the trick about loose skin. I don't know if we've done this with you in the past. We're going to do it with a group here
Yeah.
today. Yeah. In other words, your body's skin is elastic. And as we get older or with smoking, the elastin fibers in the skin begins to go away. So look at a 14-year-old girl and look at a 90-year-old woman, and you'll see a difference in the skin. That tone, that elasticity, the plumpness begins to deteriorate. And then it's different in different people. Some people have very stretchy and elastic skin. So think of your friend who delivered a baby, delivered twins, and then snapped back with a rock-hard abdomen a couple of weeks after the pregnancy. And then somebody else who had a pregnancy and never got it back. The same thing can happen with you after you lose weight with our surgery. Sometimes if you have a lot of elastin in the skin, you'll snap back and we'll be really surprised. You cannot even tell somebody's had weight loss surgery. The flip side, though, is that we can test that right now, if you want, by pinching the back of your skin and just get a good grip on it, and we're going to let go and then count in seconds until it goes completely flat. And let me show you mine first. I'm going to let go and go 1, 2, 3, 4, 5. That's an old man's skin. So go ahead and let go of yours and see. It should go 1 second.
3 or 4. 3 or 4.
Yeah, you're an old man.
Thank you very much.
So some of us are fortunate, and we can have that skin snap back, and you won't need any plastic surgery. And so we'll just have to wait and see.
and I'm off my sleep apnea machine.
Yeah. All right. Good. Congratulations. Thank you.